Now we'll discuss about the pulp space of hand. Here you can see here this point or the terminal phalanx. Here pulp spaces are present. These spaces are clinically very important. If you cut a section at this longitudinally, you will find this is nail bed. Here is nail bed. Here is position of this is nail bed. Here is terminal phalanx. This is periosteum. Here is periosteum of the distal phalanx. This is periosteum. From periosteum to skin, there are numerous septa. These are fibrous septa. It divides the terminal phalanx into numerous pulp spaces. These are numerous pulp spaces. These spaces are filled with fat. These spaces are filled with fat, and by these septa, these fibrous septa, this area is divided into numerous compartments, and each compartment is tightly arranged and tightly filled with fatty tissue. And here is this terminal phalanx. From here to here, about 4/5 part of the terminal phalanx, and this is proximal 1/5 part of terminal phalanx. This is distal 1/5, and this is proximal 1/5 part of the distal phalanx. Here is artery which gives supply to this. This is digital artery. Digital artery passes by piercing these septa. It gives numerous branches. These are numerous branches which give supply to distal 4/5 part of this terminal phalanx. And this proximal 1/5 part, that is, this part is epiphysis. This is diaphysis. This epiphysis is supplied by branch which do not pierce this septa. This branch arises just proximal to this septa. So in case of infection, if any compartment of this become infected, suppose this become infected, this artery here become occluded, and the arterial supply of this terminal 4/5 part of this bone become affected. And this, if neglected, if pus is not drained, then this portion become necrosed. Here the infection causes severe throbbing pain due to tight compartment of this. So if the infection is neglected, pus is not drained properly, then these arteries become occluded. These branches become occluded, and this part become necrosed. And same time, this part become unaffected because its arterial supply comes prior to entering to this. So this become unaffected. Infection of this is known as vitiligo. Vitiligo. So this is all about what another important thing related to this. For draining of pus, the incision is given on the lateral side, like this, here, like this. This incision opens many compartments, so pus can easily drain from all infected compartments. So this is all about the pulp space of fingers. Yes, now I'll discuss about the forearm space of pyramid. These are potential space filled with loose connective tissue present in anterior compartment of the forearm. These are clinically very important spaces. So here is, in this diagram, you can see this is radius, this is ulna, here is interosseous membrane, this is flexor retinaculum, this is flexor retinaculum, this is flexor retinaculum. Here one muscle is present, that muscle is, this muscle is pronator quadratus. This is pronator quadratus. This muscle is pronator quadratus. Here is an oblique line. This is oblique line of the flexor digitorum superficialis. This is oblique line of flexor digitorum superficialis. Radial head of flexor digitorum superficialis takes origin here. This is oblique line. If you cut a section, transverse section at the distal here, you will find this is radius. This is radius. Here is ulna. This is ulna. This is ulna. Here is intermuscular septum. One, two, three, 4, 5, 6. These are 6 compartments present on posterior aspect. Here is position of this muscle. This muscle is pronator quadratus muscle. This is pronator quadratus muscle. This muscle is this. This is radius. This is radius. This is ulna. This is ulna. This muscle is pronator quadratus. Anterior to this pronator quadratus, there are long flexor tendons. These are tendon of flexor digitorum profundus. These are tendon of flexor digitorum profundus. And the tendon superficial to it, these are flexor digitorum superficialis tendon. These are the 4 tendons of the flexor digitorum superficialis. These are 4 tendons of the flexor digitorum superficialis. Like this. These are 4 tendons of flexor digitorum superficialis. Superficialis, and these are the tendon of flexor digitorum profundus. This is a transverse section at this level. Like this. So here you can see this is proliter quadratus and these are long flexor tendons. So this space, forearm space of peroneum is present here in between these two structures, this structure and these long flexor of tendon of the forearm. So here is position of this space, this is position of forearm space of peroneum. This is position of forearm space of peroneum. This space is filled with loose connective tissue. So this is situation where it is present, and its extension is, it may extend proximally up to oblique line of flexor digitorum superficialis up to here, and distally it extends up to here, proximal margin of flexor retinaculum. So it may extend here to here, यहाँ से आता है, and it lies between these two structures. If this infected, if there is infection, this is ulnar bursa. Here is position of ulnar bursa. This ulnar bursa is infected. Then infection may reach up to this here. Then it becomes infected. And if this infected, pus point is formed usually here. This infection reaches here like, and pus point is formed here on lateral side. So for draining of the pus, the lateral incision is required. Incision is given here, over here, for removing the pus. So this is all about the forearm space of peroneum. Just now we'll discuss about the thinner space. In previous lecture, you have seen the mid-palmar space. Here, this is mid-palmar space, this is medial palmar septum, this is intermediate palmar septum. And here, there is proximal transverse crease. This is distal transverse crease, this is proximal transverse crease. This is, again, this is triangular space present in lateral part of the hollow of the palm. Its extension is proximally up to distal margin of flexor retinaculum, distally up to proximal palmar crease. This is proximal palmar crease. This is distal palmar crease. So this is proximal palmar crease from here to here. This is thinner space. This thinner space may communicate here with mid palmar space here, and it may communicate with space of perona proximally, and distally it may communicate with first lumbrical canal. This is lumbrical canal, first lumbrical canal. Boundary of this anteriorly, this in this diagram, this space is here is this space. This space is thinner space. Anterior boundary, it is bounded by palmar aponeurosis, long flexor tendon of index finger, that is flexor digitorum superficialis, flexor digitorum profundus, and first lumbrical. These structures form the anterior boundary. And medial boundary is formed by intermediate palmar septum. This is intermediate palmar septum. And lateral boundary is formed by lateral palmar septum and also tendon of flexor pollicis longus. So these are boundary of this thinner space. If this space is infected, then pus can be drained by making incision over the first baby space and posterior aspect here. So this is all about the thinner space. Thank you. Now we'll discuss about the dorsal spaces of the hand. Here in the dorsal region of the hand, there are two spaces. One space is just below the skin. This is skin, just below the skin. This is subcutaneous space. This space is subcutaneous space. Another spaces, here you can see these are numerous tendons of the extensor compartment. These tendons here become flattened, aponeurotic, and joined with each other, form an aponeurotic sheet. Just below to this, there is another space that is known as subaponeurotic space. This space is subaponeurotic space. This space is also known as subtendinous space because it lies deep to extensor tendons. Boundary of this anterior boundary is anteriorly bounded by first, second, third, fourth, fifth metatarsal, and first, second, third, fourth dorsal interossei, first, second, third, fourth palmar interossei. And posteriorly, it is bounded by these aponeurosis, flattened tendons, which form the aponeurosis, and the skin. So this space is filled with loose connective tissue. This is subaponeurotic space, and this space is filled with loose connective tissue. This is subcutaneous space. If the spaces are infected, the pus can be drained by giving incision over the bed space, or pus can be drained by giving incision on the lateral margin of the dorsum of the hand here. So this is all about the dorsal spaces of hand. Thank you.